Shohada Organization in 20 years. Shohada Organization was established 20 years ago with a slogan to work for better tomorrow and to assist people in need. The scope of war then was expanding day by day. The governments were not able to provide services for the people. As the war expanded, rural population of Afghanistan was getting deprived of the access to limited facilities of the public services, such as hospitals, clinics, schools, and universities, located mainly in cities. Due to war and illiteracy, rural population lost their small public services centers located in the villages too. Over the years, there was not even a single medical doctor in the streets. Diseases like appendix would not be treated. Blood pressure would not be diagnosed and treated, and when it led to stroke to someone, their death was called sudden death. The intensity and expansion of war in Afghanistan harassed even people with most patience and least expectations. This group of people, whose number exceeded 6 million, took risk and left Afghanistan. Soon after that, a large number of most unfortunate people who gathered in refugee camps in the neighboring countries drew the attention of countries and international organizations, including the United Nations. Simultaneously, the internal situation of Afghanistan was soon realized by international aid agencies, including the UN. An effort to assist Afghans began slowly. The area of activities and coverage of aid agencies began to expand. But at least large areas in central highland of Afghanistan, or Hazarajat, continued to remain deprived of international aid over the years. Under such circumstances, Hazarajat, or central highland of Afghanistan, was indeed a forgotten area, and its residents, as if they were the cursed on the earth, were deprived of everything. Shohada Organization, under such circumstances, was established with the aim to meet the needs of millions of needy and forgotten human beings. The performance of Shohada Organization is indeed linked with the name and activity of its founder, Dr. Sima Samar. From 1981 to 1983, she was in Jowhari district, where she was running a small private clinic and was alone involved in treating local people and wounded of the war. In her efforts, Dr. Sima Samar realized that there was a big gap between people's needs and available facilities. Dr. Samar migrated to Pakistan in 1983 and began to work with a hospital in Quetta, the capital center of Baluchistan province, and was routinely visiting Muhammad Khail camp, one of Afghans' refugee camp, 3 days a week. Founders of Shohada Organization came to this conclusion that getting involved in transient and day-to-day programs would not heal any ill, and instead, there should be efforts to meet basic needs. Based on this approach, Shohada Organization, from the very beginning, viewed education and health as two important and vital areas and focused its programs on these fields. It was natural that such work would be limited because no Afghan charity organization was able to operate throughout Afghanistan due to shortage of budget, staff, and tens of other problems. Shohada Organization, therefore, chose to work in Hazarajat inside Afghanistan because aid agencies would rarely will to risk to go to and work in Hazarajat. It may appear hard to believe, but the reality is the UN did not have any activity in many areas of Central Highland until the year of 1995. That is, more than 10 years after the war began in Afghanistan. For 10 to 15 years, forces in Central Highland were fighting one another in civil conflict, which rendered people wounded, displaced, and homeless. Poverty was back-breaking. Having witnessed these problems, Shohada Organization felt the needs of the people and had to continue to work in this area. Central region faced intense drought. Many local people, due to 8 consecutive years of drought, which was unprecedented in contemporary history of Afghanistan, lost their livestock. Their fruits dried up, and their annual income, which was driven from livestock and agriculture, dropped sharply. Continued drought and war had paralyzed people of Central region when another problem rose and the Taliban besieged Hazarajat. People were unable to have access to foodstuffs. It was very hard to work in the early years after the organization began its activities. Every founder and staff of Shohada Organization had bitter memories from those years. For example, construction materials of Shohada Hospital were looted in Jauhari. Excommunication of founders and insult of employees of Shohada Organization continued over the years. What make, however, those bitter memories to be forgotten are the results the organization's work has produced. Throughout their history, Afghanistan in general, and Hazarajat in particular, have received least work in the field of expansion of education. This deprivation doubles when it comes to Afghan women and girls. With this issue in mind, education of girls and women was of vital and strategic importance for Shohada Organization. Shohada Organization, over the last 20 years, has built or reconstructed 100 schools, most of which are high and middle schools. But 96 schools have been built by Shohada Organization over the last years. 63,000 people have studied in Shohada schools, and more than 2,500 people who graduated from Shohada high schools have been admitted in universities. Soon after establishment of these schools, the organization realized that one of the basic needs in the field of education was lack of professional teachers. In order to address this problem, Shohada Organization initiated Teachers Training and Promotion Program. Since 2002 to 2007, 4,867 teachers were trained in 3-month Teachers Training Program. In the year 2000, Institute of Sciences was inaugurated in Quetta City. This institute was operating till 2003 in Quetta, but after the beginning of new process inside Afghanistan, the institute was not required to operate in Quetta any longer. Another initiative was the establishment of Vocational Training Center. The purpose of this educational institution was to provide vocational and professional trainings to those who, for any reasons, cannot continue their studies. Since 2003, totally 70 people have undergone vocational training, which enabled them to find job and income. Inter alias, the people of Afghanistan, after years of war and conflict, suddenly came to face waves of new phenomena, such as democracy, human rights, women's rights, the right to vote, the right to elect, freedom of expression, and freedom of opinion. There is fear that any misunderstanding or misinterpretation of these new concepts might once again plunge Afghanistan into crisis. Shohada Organization therefore realized that participation in this process would be vital for both Afghans and the government of Afghanistan, and began to conduct programs which could assist 12,000 women in 2003 and 2004 in this regard. Shohada Organization health programs. For the first time, it was in 1988 when Shohada Organization, with assistance of CWS, established a clinic which was later upgraded to Shohada Hospital in Quetta. The hospital treated refugees free of any charges. Between 280 and 300 outpatients were treated on a daily basis. The surgery section of the hospital had 15 beds. Averagely, between 30 and 45 surgical operations were conducted on a monthly basis. The X-ray, laboratory, ultrasound, and vaccination wards were operating. This hospital continued to operate till 2004 in Quetta City. The patient's registry shows that the hospital treated more than 1.5 million patients in its 16 years of operation. Shohada Hospital, Jaghori. The foundation of the Jaghori Hospital was laid in 1998. Its construction work was initially planned to be completed in 2 years, but due to the aforementioned obstacles, including 3 times looting of construction materials by armed groups, it was finally completed and inaugurated by Dr. Sima Samar in 1994. With 52 beds, the hospital has surgery ward, internal disease, mother and child care, ultrasound, X-ray, laboratory, vaccination, and family planning branches. On average basis, 90 to 100 outpatients are treated daily and 35 to 40 operations are done monthly. Taqab Hospital, Behsud. The foundation of the hospital in Taqab Valley of Behsud district was laid down in 1978. However, before the hospital was inaugurated, Afghanistan plunged into civil conflict and the building of the hospital was, instead, turned into a jihad front. Shohada Organization conducted an initial assessment of the possibility of reactivating the hospital in 1996. It took 1 year to complete the renovation of the building and the hospital was inaugurated in 1997. The hospital is equipped with internal medicine, surgery, mother and child care, X-ray, laboratory, ultrasound, and vaccination facilities. Some 12 to 18 average surgical operations are conducted on monthly basis. Shohada Hospital, Yakaulang. Shohada Hospital in Yakaulang was initially founded by the former government, but it was largely damaged by Taliban bombardments. After the fall of Taliban in Yakaulang, the hospital was renovated and reactivated by Shohada Organization. In addition to previous wards, ultrasound, X-ray, and vaccination sections were also opened. The hospital has currently 35 beds and receives average of 80 to 100 patients per day. Between 25 and 28 cases of surgical operation are recorded per month. Since its inception, Shohada Organization administered hospitals have treated about 2 million people. Shohada clinics. In addition to these hospitals, 6 mothers and child health clinics were also established in Jaghori. They didn't have medical doctors, but were run by 1 or 2 nurses, and serious patients were referred to Jaghori Shohada Hospital, which was not far away from the areas, and people could easily take their patients to this hospital. However, clinics in areas outside Jaghori district had medical doctors and other necessary equipments, and local residents could be treated in these clinics unless they had serious diseases. These clinics are situated in Khawat of Nahur district, Jagashev of Nahur, Sarab, Lal, Sarjangal, Kartes Solh, Bamiyan, and west of Kabul. Another aspect of Shohada Organization health programs was to train nurses. Based on an assessment conducted by the organization, professional health staff was one of the most pressing needs in Central Highlands. 701 nurses, most of them women, received training under the nurse training program conducted by Shohada Organization in Pakistan and Johri. One of the scares left by war is children who have lost their parents in Afghan society. In such a context, undoubtedly, women and children could fall victims once again. Shohada Organization therefore decided to provide assistance for women and children that constitute the most vulnerable strata of the society. It was the very understanding and approach on the basis of which Shohada Organization established Summer Ashiana and safe houses. The summer orphanages were established in 2002. The first Summer Ashiana, located in the center of Johri district, has two separated buildings for girls and boys. The second Ashiana is located in the center of Bamiyan province. In total, there are 122 children in these two orphanages. Shohada Organization intends to continue to sponsor these children until they graduate from universities. In 2004, it was discovered that 40 women and girls without guardians who were deported from Iran were in the prison of Herat. The Afghan Independent Human Rights Commission and the government of Afghanistan decided to hand over these women and girls to the safe houses of Shohada Organization. The deadly civil conflicts left thousands of Afghans homeless. Among these shelterless people, residents of center of Bamiyan province went through the most deplorable situation. They were displaced. After establishment of interim government, they were returned to their places of origin, but they even did not have shelter. Therefore, they had to seek shelter in caves around Buddha statues. Shohada Organization planned to build houses for them. The government accepted to provide the organization with the land for shelter, and it constructed houses for 70 households, one for each, which had 3 rooms, kitchen, bathroom, and corridor. This township, which is named Karte Sulh, is currently conducting a vocational training for women. In this center, all women from this township and its surrounding areas are learning carpet weaving, smith and cooking chips. Literacy courses, healthcare education, and human rights courses are conducted in this center. It is not possible to explain the performance of Shohada Organization in such a short span of time. What you saw was just a part of the works and activities Shohada Organization has conducted. Through conducting programs like blanket weaving, Shohada Organization has distributed about 200,000 blankets and tents for the needy Afghans in refugee camps in Pakistan, victims of earthquake in Nehrin and Faryab, and displaced of Afshar. The organization distributed more than 3,600 tons of foodstuff and fuels to needy refugees in Pakistan and inside the country, which cannot be detailed here. In short, effort has always been made to heal a wound, bring a smile to a lip, and make a family happy.